Now we will be discussing another chapter in related with the osteoarthritis, that is the knee osteoarthritis. Again, knee is also one of the weight bearing joints. So the symptoms what we see in the hip, the similar kind of symptoms also will be seen in the osteoarthritis of the knee joint. What is that? Associated with the articular cartilage destruction, right? There would be joint space narrowing, and there would be subchondral cysts which are getting formed, and irregularity of the articular surfaces is taking place, that can lead to like a ligament laxity, and stability of the joint is being lost, and the normal smooth range of movement of the joints they are getting inhibited, and there would be pain in the joint. So the person will have pain, lack of range of movement, loss of range of movement, then the person will be complaining of carrying out the functionality, right? There would be deformation of the joint, and also there would be gait changes. So when we take an X-ray, right, what we will find in the sense, the similar kind of things, there would be reduction of the joint space, and there would be osteophytic formation, and the next thing we will be finding this particular subchondral cysts. Now I would like to highlight one particular examination, right, when we are doing these X-rays, right. So that is about knowing the how much damage is there in the joint because of this particular osteoarthritis. Now when we are looking at the X-rays, right, we will be finding certain things associated with the joint destruction. There is a Kellgren-Lawrence system that will tell us that, okay, how much joint destruction has taken place in the joint. So he has got a grading for that, right. So first is 0, right, there is no articular cartilage damage, or not no osteoarthritic changes are there with the joint. Now grade 1 is that there is a suspicious change in the joint space, but no arthritic changes like bony spurs, and no destruction of the cartilage is being seen there, right. And grade 2, right, after that the grade 2 comes, that there would be a reduction of the joint space, definite reduction of joint space, multiple osteophytes are being seen, and there would be like unevenness of the articular surface. The grade 3, right, will be finding moderate osteophytic changes, joint space is being reduced, and then there would be a relative sclerotic changes. Sclerotic changes in the sense we will be finding a little bit of whitish things in the bone, that is actually dead bones basically. Because of the compression, there would be the minute arteries, the damage, right, of the bone, that is preventing the blood flow to that particular area, they are becoming white. If it is in the grade 4, what we find there is the large osteophytes, marked narrowing of the spaces, greater level of the sclerosis, then will be having definite bony deformities at the ends. Now we will be discussing about the different physiotherapeutical approaches in treatment of the osteoarthritis of the knee joint. The first one is associated with the pain management, right. As we know that the pain is there around the joint, and it is mostly mechanical in nature, and so we have to correct the mechanics as well as the inflammation whatever is being existing because of the excessive loading which is there, right. So we have to focus the pain management towards that. So what we can do in the sense, we can use the heat therapy, right. We can go for a paraffin wax bath kind of thing, that would actually increase the heating of the structures, right, that will warm up the structures. Warm structures, they will be more flexible, so we will be increasing the flexibility of the structures. Thereafter what we would go for in the sense, will be recruiting the isometric exercises, right. So mostly the muscle strengthening is very important around the joint, because muscles, the stronger muscles, they will produce better compressible abilities to the joint. So rigorous strengthening of the muscles which are present around the joint, that should be advocated, right? So we'll be going for isometric contractions of the quadriceps, isometric contractions of the hamstrings, and then we can go for selective range of isotonic exercises that can be associated with training the joints with the weights, and we'll be looking for increasing the muscle strength by providing the resistance. As we see this particular joint space is getting reduced, sometimes a person who is like, we can go for a manual distraction, or we can use the mechanical traction to produce a kind of separation onto the knee joint, and sometimes making a person sit, and some weight boots are being provided, or some kind of weights provided around the ankle joint, that would be giving a longitudinal distraction of the joint. So that would be towards facilitating the space of the joint. And then next, what we can do in the sense, certain review of literatures, right? So they they have suggested to go for graded mobilities, right? So we'll be going for oscillation of the joint in a specific direction to improve the range of movement. So usually if you are using this particular Maitland technique of applying manual therapy in a graded manner, like grade 1 and grade 2, usually that produces the spasm release. The spasm release is associated with the grade 1 and grade 2. So when the muscle spasm around the joint is getting released, there would be associated joint range of movement facilitation, right? And what else we can do in the sense, the strengthening, as we said, thereafter we are looking into this manipulation technique to facilitate the range of movement. Okay, then next what we can work on is that providing some kind of orthotics, right? So that will distribute weight from the joint to the it will take away the joint compression forces, rather that would be getting transmitted in a other pattern, like we can prescribe a patellar tendon weight bearing orthosis kind of thing. So what it does in the sense, it will produce a weight shift from the axis towards the dispersion of the weight into the orthosis and to the remaining part of the limb, right? So that causes joint compression less. So usually a prolonged use of that kind of orthosis might help us recovering from certain, like if it is a grade 1 or grade 2 osteoarthritis, we can see a little bit of a difference in the pain as well as mobility of the person, right? And the other things, when the joint is destroyed, like if it is according to Kellgren Lawrence grading, if it is coming somewhere between 3 and 4, right, and there is a marked function loss, in that conditions, what we can do in the sense, we can ask the person to go for a arthroplasty. Already we have discussed in arthroplasty, like knee arthroplasty, and the components and relevant physiotherapy associated with that. So this would be the line of management of the physiotherapy, like first examination, the range of motion, then weight bearing activities causing pain, and limitation of the functional activities. Then what we are trying to do in the sense, we are going to relieve the pain by using certain electrotherapy modalities, and we are going to facilitate the range of movement by graded mobilization. Then we have to go for strengthening of the muscles around the joint, like we will be emphasizing on the strengthening of the quadriceps and the strengthening of the hamstrings. But sometimes the strengthening of this gluteus medius, that also helps in relieving the pressure from the knee joint. As we see that the destruction of the joint, right, that is driving the joint towards the deformations. So we can control the deformation. We'll try to go for an orthotic appliances in order to contain the deformation. So this management, that will help in regaining the functionality, strength, mobility, and reduction of the pain. Now we'll be going into the osteoarthritis of the hand, right? So usually osteoarthritis is a condition associated with weight bearing joints, but in some conditions, some people will have osteoarthritis of the hand, right? There would be what there is a like a familial predisposition is there, right? That might run in some families, right? What do we find there? In the sense, there would be arthritic changes associated with the small joints of the hand, and the functionality of the hand is being reduced, and we would be finding that hand is the bones are getting enlarged in shape, which is causing restriction of the range of movement, and there would be deformations, and we'll be finding sometimes nodular alterations around the joints, right? So the hand function for gripping and all, it would be difficult. So sometimes, other than this familial predisposition, the kind of occupation the person is doing, that would be actually one of the factors, like it is associated with kind of heavy lifting, holding some kind of hammer, hitting the things like ironsmith work, right? So daily laborers, right, who put their hands into a kind of working for lifting weights and maneuvering things, those people, they might get this particular arthritic changes of the hand. Sometimes the previous injuries, like imbalance, are created by the previous injuries that can predispose for the osteoarthritis of the hands, right? And women postmenopausal, as we know that the calcium metabolism, calcium absorption mechanism is getting associated with the hormonal imbalances, that can also cause the arthritis, osteoarthritis of the hand. The clinical features, as we know that it is going to cause the limitation of the range of movement, restriction of the functional activity, there would be tenderness and deformation associated with that. The functionality of the person also is getting reduced while attempting for the movements. So there would be pain on movement, the swelling of the joints and restricted range of movement, and indirectly that is causing weakness of the muscles, because pain causes inhibition of the muscle activity. So that is reducing the functionality of the hand. The other specific features associated with this are the crepitus as well as deformation, the enlargement of the bones, right? Because the stress causes enlargement of the bone, right? These are the associated features, clinical features for the arthritis of the hand. Now I'll be talking about the investigations. What investigations are used? Usually we can go for the radiographs. In the radiographs, the features of a very classical osteoarthritis will be seen, that is reduction of the space, osteophyte formation, and then deformation of the joints, and subchondral cysts, right? These all will be the clinical features associated with the hand, and there would be associated hand dysfunction, and sometimes we can go for taking the investigations like MRI. So if that can give us some more features for better investigation. After the investigations, after looking at the joint damage assessed either in the X-rays or the MRI, and after the thorough physical examination, the physical examination depends on observation, the kind of deformation or attitude of the hand. Then we are going for physical examination, we will be checking the active range of movement, passive range of movement, the kind of restriction it is there, and we will be looking for the any other associated complications like deformations or other joints are being involved in that, or any kind of muscular weakness, and any nodule formation or any hardening of the skin. These all are supposed to be considered when we are doing a physiotherapeutic assessment. After the physiotherapeutic assessment, what we are going to do in the sense would be treating the conditions for the pain, lack of range of movement, and increasing the functionality. For this particular purpose, we will be using the pain modalities like heat, right, then manipulation, then passive movements, then strengthening of the muscles. And as the deformation is one of the factors associated with that, we will be providing the right kind of customized orthotics for the containing the deformations. So the physiotherapy is guided towards improving the range of movement, right, as well as maintaining the range of movement and preventing the deformation. Other than that, what we need is that flexibility of the skin, right, as well as we'll be looking for any nodular things like it might be because of kind of hardening things. So we'll be using certain softeners for the skin, that also will be helping in producing the flexibility of the joints, and the muscle strengthening around the joint like the flexors, extensors. So that should be taken for strengthening exercises, resisted exercises, or we can go for a joint distractions passively followed by flexion activity, joint compression activities followed by extensor activity. I'm just trying to correlate with the PNF principles. Joint distraction is every time it is associated with the flexion range of movement, and when we are compressing the joints, that would be stimulating the extensor activity. So likewise, we can induce the activities in a neurological phenomenon, and also we need to look into the intrinsic strength and lumbrical strength to produce the functionality of the hand.